Hello, I'm Walter Koroshetz, the Director of the National Institute of Neurological Disorders and Stroke, and I want to thank everyone at NIH and NINDS for getting through a tremendously challenging year. We did it, and congratulations. Here at NINDS, I lead an organization of talented people who work together to advance our mission, and that is to learn about how the brain and nervous system work and to use that knowledge to better treat and prevent tragic neurological disorders for all people. I would like to congratulate the recipients of this year's NIH Directors Award. The award recognizes staff from NINDS and across the NIH for their outstanding work and dedication to not only our institute's mission, but to the mission of the NIH as a whole. Despite the challenges we faced this year, these individuals went above and beyond, and then above and beyond some more. And this makes me especially proud to announce the recipients of the 2021 Directors Awards. In the scientific and medical category, I'm pleased to recognize the Trans-NIH Post-Acute Sequelae of SARS-CoV-2 Initiative Leadership Team for exemplary work in launching and developing this, what we call the PASC or Recover Initiative. This initiative seeks to understand, prevent, and treat the prolonged or new symptoms that develop after an acute COVID infection. Long COVID patients we know suffer from pain, headaches, fatigue, brain fog, depression, and other debilitating symptoms. We really need to get a handle on what's causing this so we can better develop treatments. The team is an incredible group with a range of expertise. They worked around the clock to develop and launch this initiative in record time. The national effort that brings together scientists, clinicians, patients, and caregivers to learn about long COVID. This historical effort includes hundreds of researchers in over 200 clinical sites across the nation. Studies will include diverse participants, including adults, pregnant women, and children. Recover will also create a core resources to support the initiative, harmonize data and data sharing, leading to robust and impactful research. Also in the scientific and medical category, I'm pleased to recognize Dr. Avindra Nath, the clinical director of NINDS, for his commitments in conveying scientific information on COVID-19's effects on the nervous system. His research combines basic and clinical approaches to study the pathophysiology of viral infections of the nervous system with a focus on HIV and retroviruses. He's become our leading expert and spokesperson on the neurological impacts of COVID. In the early days of the pandemic, he quickly adapted his research to study how COVID infections affect the brain by examining postmortem brain tissue from COVID patients. He also recently launched 2 clinical studies studying folks who have persistent symptoms, the long COVID symptoms. Alongside his research, Dr. Nath readily took on opportunities to explain his latest findings to researchers, patients, and the public. In 1 year, he's been featured on BBC, Bloomberg, NBC, NPR, and countless other major national and international news outlets. And he's also been recently elected as a fellow of the American Association for the Advancement of Science. Even beyond his own work, Dr. Nath stayed up to date with COVID and its impacts on society, walking us through the science of COVID with ease and making informed predictions about what to expect in the years to come. Thank you so much, Avi. In the administrative category, I'm pleased to recognize the return to the physical workplace at the Porter Research Building at the intramural campus. This group went way above and beyond to coordinate communication and emergency response activities for NINDS intramural staff and Porter resident institutes during the COVID-19 pandemic. No easy feat. The team worked together to ensure a smooth return to work for the staff working in the Porter Neuroscience Center. The building houses over 800 neuroscience researchers from 85 labs spread across 10 institutes and centers. And so with many different personnel, labs, and offices in one place, you can imagine the coordination needed to return to work, a real challenge in these unpredictable times. So thanks to the team, the trainees, the investigators, the animal care staff, the facility staff, and many others who made a safe return to work possible. In the Common Fund Leadership Program, I'm pleased to recognize the NIH FIRST Program Working Group Project Team for superlative efforts in the development of the FIRST program that seeks to enhance cultures of inclusive excellence in the biomedical research community. This group led to the development of what we call the Faculty Institutional Recruitment for Sustainable Transformation Program, also called the FIRST program, a program aimed to transform institutional cultures across the country by enhancing and maintaining cultures of exclusive excellence and funding new recruits and diverse hires as early career faculty. The program is unique, the first of its kind at a large scale. Developing FIRST required a dedicated team with a well-informed and unified vision of the future of biomedical research. And here at NINDS and at NIH, we are all greatly committed to building an inclusive, diversity of scientific workforce. And as a member of the FIRST leadership team, I'm especially thrilled to see this pioneering program come to light. The FIRST award recipients were just announced in September across the country. Looking forward to see how this works out. Also in the Common Fund leadership category, I'm pleased to recognize the Trans NIH Accelerating Leading Edge Science in ALS, or amyotrophic lateral sclerosis. This team showed great leadership in the implementation of the new Trans NIH ALS program. The team launched ALS Squared, an exciting new research initiative aimed to dramatically advance our understanding of what triggers ALS and what drives the rapid progression of paralysis in this fatal neurological disease. The initiative is part of the Common Fund's High Risk, High Reward program and has a budget of about $25 million over 5 years. Recently, there's been excellent progress in our understanding of ALS, sometimes known as Lou Gehrig's disease, but breakthrough treatments are really still lacking. Hopefully, we can bring something from the bench discoveries to really help people really suffering from this really terrible, tragic disorder. The ALS Squared program has three-pronged strategy. One is to adapt new technologies for multiple fields, attracting new talent from diverse scientific disciplines, and understanding disease convergence. So reaching out to other areas of science to bring in new ideas that can help us advance the understanding and treatment of ALS. So thanks to the team for taking the lead on this exciting initiative. And very pleased to recognize Dr. Angel de la Cruz Landau for receiving the Harvey J. Bullock Jr. Award for Equity, Diversity, and Inclusion. The Harvey J. Bullock Jr. Award was established to recognize employees who champion the ideals of equity, diversity, and inclusion. And this award recognizes Dr. de la Cruz for his accomplishments in progressing the development and advocating for the inclusion of all represented groups in the neuroscience, specifically recently the Hispanic and LGBTQ communities. Dr. de la Cruz is Scientific Program Manager in the NINDS Division of Intramural Research, where he serves as the Summer Diversity and Postbac Program Coordinator. And over the years, he has greatly enhanced DEI activities at NINDS, NIH, and in the community. He started his career at the NIH in 2012 in the Graduate Partnership Program. As a postdoc, he worked in the NIH Office of Intramural Training and Education under the esteemed Dr. Sharon Milgram, where he coordinated the high school scientific training and enrichment program. He is dedicated to helping trainees at every level. As part of the leadership of the NIH Society for the Advancement of Chicanos, Hispanics, and Native Americans in Science chapter, he helped provide new opportunities in career development and mentoring in the NIH community. He also served on committees aimed to disseminate NINDS's mission through local neuroscience outreach activities for kids in the neighborhood, particularly those from underrepresented groups. So here at NINDS, we're really proud that Dr. de la Cruz oversees training and career development of interns and trainees, many of whom have gone on to lead successful research careers. Congratulations to all of the 2021 awardees. Thank you all.